us critically helps to manifest good or ill health within a human being. And of course, then you can go on to saying healthy human beings sitting in healthy human families, sitting in healthy human communities, in healthy bioregional alliances, and in healthy ecosystems and a healthy planet. So what affects that microbial ecosystem within us, of course, is the environment. And the bizarre thing, we also talked about that we live in a world where we have a food industry that sells us food not caring about health, and we have a health industry that treats illness, that has a pathogenic approach to health, rather than taking a salutogenic approach and paying attention to the importance of what we eat and the environmental health around us. We're beginning to see the first steps with biophilia and biomimicry in hospitals, showing that it's very clearly clear that people heal faster in hospitals where they have access to green nature and can see trees, because we are biophilic creatures. And also we're beginning to have the first voices that all this killing of the microbial flora around us is actually creating problems in the immune system development of children. It's wrong to have children in a sterile environment because they can never develop this diverse internal ecosystem that maintains health throughout their lives. And this begins with feeding mother's milk rather than formula milk, if possible. For some people it's not possible, but for most people it is. And it's so important to help the child develop a healthy interior ecosystem. And so is that the child has contact with dirt and with a wide variety of microbes that can populate the ecosystem within. This includes the diversity of lactobacillus and bifidus and yogurt and all those kind of things, kefir, but it also includes fungal biodiversity and bacterial biodiversity. And so a scale-linking, salutogenic, health-generating approach pays attention of how we can help the manifestation of health, the emergence of health as an emergent property of a complex dynamic system at the scale of the individual and at the scale of the ecosystem within which the individual has their life. Because of course all these environmental stresses are massively influencing how health emerges at the lower level and at the higher level, at the biosphere health. So it was just wonderful to finally talk to somebody who is one of the world's most renowned health specialists, who was working for the Australian government as the head of public health for a large part of Sydney for a while, and then went back into academia and spent a few years in Malaysia running the unit of the UN university that does research to support health policy. And now he is back in Sydney building this platform for planetary health at the University of Sydney. And we talked about possible collaborations. He invited me to contribute to a book. And excitingly, we also started dreaming into this idea of maybe the world doesn't just need a World Economic Forum, it actually needs a planetary health forum, and how that forum could look and how it might be a decentralized forum so more people could get involved with it, and who might be key actors in participating and funding such a vision of an annual planetary health forum. And for me, it's just such a wonderful, deeply gratifying development to know that in a tiny little way, and only for some of the people involved, I have provided frameworks of thinking, the kind of intellectual scaffolding that they have used to develop the field of planetary health further. And I'm also really excited to re-enter this new health, to in more detail now read the Lancet Rockefeller Commission report on planetary health, which you can just download on the internet, and to look at how everything I do, my work with Gaia Education, could potentially take a turn towards developing courses that look at this scale-linking salutogenic design for human and planetary health. Ultimately, the word regeneration captures in one word what I was working on in my PhD research in 2003, 4, 5, and 6. Really, I already started to understand this link when I was doing my master's in holistic science, and suggested that ecological design was the practice end of the holistic sciences and the holistic, participatory, integral worldview that we were exploring at Schumacher College. And while in human terms 12 years seems like a long time, in terms of the transition we're in, I'm amazed that we now find that this concept of planetary health is catching on, and that there's real support in working on it. And the important bit is that it becomes change-oriented, action-oriented, implemented as quickly as possible. And that means that we need to collaborate with organizations like the Common Land Foundation, like the Ecosystems Restoration Camp Foundation, and the different ecosystems restoration camps that John Liu and the cooperative has helped to launch, or is launching now in different parts of the world. And all the good work of the people in this wider movement that I've called Regeneration Rising, Carol Sanford's work with regenerative business, her influence on the wonderful work of Gregory Landau and Ethan Rowland and their different outfits, the Regen Network, and their hard work on trying to create an actionable process that brings funding into ecosystems restoration, and at the same time finds a way of measuring and verifying regenerative impact on healthy ecosystems function in a particular place, in order to make sure that there is a certain check and balance on where the funding goes, and that it actually has an impact on salutogenic design of a particular place. Regeneration International, linking up lots of people around the planet that work on regeneration. The global ecosystem, the global eco-village network has come on board with the term regeneration and sees their network of communities as community-focused field study and experimental sites to bring about a way that humans live in support of the healthy ecosystem function of the ecosystems they inhabit. So in many ways, these communities aim to become salutogenic, health-generating communities. And there would be a lot of studying that could be done there on the impact of living in an eco-village community on psychological, mental, physical health. The person that I took the word salutogenesis from when I together with Seton Baxter coined the term salutogenic design, is called Aaron Antonovsky. And Aaron Antonovsky, in a book called Health, Stress and Coping, looked at how Holocaust survivors were able to live to a ripe old age and somehow deal with the trauma that they had lived through in concentration camps. And what he found is that after thousands of interviews is that social cohesion and being bound in a meaningful story that made them connected to their roots, their future, their present, their community, and the world, was a key element of being able to live through and also to deal with the trauma generated by these horrific experiences afterwards. And so eco-villages have an enormous amount of social cohesion and community cohesion, and in that they create a framework of meaning for people that helps them heal and makes them healthier people. So as you can see, in this planetary health perspective, we walk through all the 4 quadrants of the integral framework. We look at both the interior individual and the interior collective, the worldview, the value system, the deeper insights of interconnection, but also the cultural process of bringing forth a way of living together that is creating a salutogenic culture. And then on the outside, in the exterior individual and the exterior collective dimensions, it is about creating health as we look at product design, architecture, community design, industrial ecologies, bioregion or city and urban design, bioregional planning, and the wider than bioregion cooperative networks that can happen at the national and international scale. And we see these salutogenic networks emerging now. They are all these organizations that I've mentioned already, and there are many more. And we know that in order to address climate change, which is basically Gaia's fever, a planetary response to our destructive and degenerative practices over the last 5,000 years, and particularly the last 250, 300 years since the Industrial Revolution really got going. And we need this salutogenic response at all scales. And the good thing is, it is already happening. There are people looking into healthier materials that are biomaterial based, that don't off-gas, and because that's another key element of health, the air we breathe. And whether it's dealing with air pollution in cities and finally banning internal combustion engines, initially from cities and then from entire bioregions, and as soon as possible from the planet, and shifting towards electric engines and hydrogen engines, possibly in some cases, that do not have those nauseous emissions that have such a strong impact on human health. But it's also about stopping to use all the byproducts of the chemical industry, which off-gas toxic chemicals, and therefore create very unhealthy indoor environments. Many offices with their cheap carpets and the glues used in the furniture, and the plastics used in the furniture and the materials and the curtains, and then fire regulations adding flame retardants to everything, which are demonstrated as being carcinogenic. And yet we still have regulations that force us to put these carcinogens on every hotel room pillow and every hotel room bedsheet and many public building upholsteries and so on. So you can see that there's something about this concept of planetary health as a scale-linking factor that demonstrates whether we are acting regeneratively or degeneratively, and that there is so much work to be done. Also, as I mentioned before, in particularly the way we grow food and we grow biomaterials, and how food affects our health. That I'm just thrilled to have made this connection, and this was a rather long diary entry. I wonder if anybody actually gets to this point and listens to it all the way to the end. But I would love your comments, any links that people have to health-related articles and groups that work on this intersection between human health, environmental health, and planetary health. I'd be very interested. And I just hope that I find a new way of creating maybe an institute or some kind of association that allows me to receive funding to be able to do this work more. Because one of the other things that I talked with Anthony Capon about is that I find it very hard to join these meetings at the famous Bellagio Center on Lake Como that the Rockefeller Foundation has. Wonderful place, I'm sure. And meeting there with brilliant people to talk about planetary health is something that I would learn a lot from, but maybe I could also contribute something to. But very often, the people who meet are financed by governments or by the universities that they work for. And independent practitioner, academic, futurists, educators, pathfinders, thought leaders, whatever category you want to force me into, often don't have the wherewithal to attend these meetings. And so I do sometimes, but every time I go to one of those meetings and it's 5 days and it takes 2 days to get there and come back, I've basically spent 7 days of my holiday allowance, and I then need to work harder to feed the family and have shortchanged my daughter and my wife from time with me. And while of course some of that is justifiable in the planetary emergency and urgency that we're facing, as some wise person recently said to me, it's not all about what kind of world we leave to our children. It's also, maybe even more importantly, about what kind of children we leave to the world. And so my role as a father and being there for my daughter, having taken the responsibility to bring her onto this planet in a deep crisis of planetary health, and facing the potential that she will live through some of the roughest decades that humanity has lived through for many, many millennia, and still being hopeful that maybe if we all together get things right and we start the decade of ecosystem restoration in 2020, or maybe better tomorrow, and we make it the kickstart of the century of regeneration, then after a few turbulent decades, which we're already in the midst of,